Hi, I'm Barry Mitchell. Welcome to Simply Science. Well, there are little signs the city is trying to get back to normal. We saw this urban pumpkin patch on the corner of 57th Street and 7th Avenue. But the threat of COVID-19 remains very real. And to help us stay vigilant, some scientists are not looking for a sign from above, but rather a sign from below. Here's Ari Goldberg.
The virus started to spread around the world and we started seeing cases in New York City. My number one concern was, how can I help out? What can I do? And I've been thinking of a lot of different things that I could do. As it turned out, we had about 10 projects and 2 or 3 of them panned out.
For Queens College biologist John Dennehy and his colleagues, the one that's been panning out is a deep dive into the literal bowels of our city.
What we're working on these days is to monitor the presence of SARS coronavirus in the wastewater of New York City. People who are infected with SARS coronavirus will shed the coronavirus in their waste stream, shall we say. So we can detect this in the sewage that comes out of everybody's home.
So let me ask you, euphemisms aside, when you say testing wastewater, you mean you're testing all of our poop, yeah?
Your poop, yes. So we're testing your poop, basically. Everyone poop collectively. We work with the New York City Department of Environmental Protection, and they do the wastewater sampling. What they do is every week they will provide us a liter of water from each treatment plant.
That's right. For all the talk of sneezing and coughing, people can shed bits of the virus in their poop as well. And while testing the waste from New York City's 14 treatment plants can't pinpoint which individuals have cases, it can help fill the gaps that in-person testing is missing.
We know that a large number of people are asymptomatic and would otherwise be undetectable unless they got a coronavirus test. With the sewage, we can passively monitor the entire community, both the people who are getting tested and testing positive, but also people who are not getting tested and are asymptomatic. Scientists have done a little bit of work to monitor other viruses in wastewater, but I've not seen any prior effort at the scale and the number of people in cities that are interested in using this as a tool for epidemiology.
Indeed, other places have implemented these tactics as well. The beauty of it, if beauty is the right word for the subject matter, is that it can detect COVID in a population before symptoms show up. Virus bits can show up in waste before they'd emerge as clinical cases, and that can be invaluable for city agencies.
So it's really precise, and we can literally detect tens of viruses in a sample. In other words, if we had 100 viruses in a liter, we would be able to detect that. But when these things are all averaged over time, and if a community has high enough numbers, we can get some fairly good numbers for how many active cases are in that community, which can inform decision-making.
How's this different from the regular nose swab test that everyone's getting? What can this tell us different?
So we feel that we can identify when cases are starting to rise again in a community prior to seeing that in the official nasal swab diagnosis. Hypothetically, if you had a lot of COVID in a region that, was being missed, I would think you would want to devote more resources to trying to identify where these cases are, to follow up with contact tracing.
Essentially, as gross as it may sound, testing our poop can act as an early warning system. And if and when cases fluctuate in the city, that is an important tool in our pandemic response toolkit.
And eventually, we're going to start seeing cases rise again in New York City. We want to be there to tell when that's happening.
New York City using your number 2 to solve its number 1 problem. Sorry. For Simply Science, I'm Ari Goldberg.
Let me ask you a question. Are you dreaming more but enjoying it less? You're not alone.
I'll see you in my dreams. Hold you in my dreams.
People's dreams have gotten much more vivid since the pandemic started, and some of them are really interesting dreams about the pandemic itself.
Harvard University's Dr. Deirdre Barrett is a dream catcher. In March of 2020, the researcher-psychologist created an online survey to record how our sleep has been affected by COVID-19. She used that data for her new book, Pandemic Dreams.
People are dreaming of bug attacks, tsunamis coming at them, of metaphors for lockdown, of nightmares about your entire child's school class coming to be homeschooled by you. People are reporting recalling more dreams, more bizarre dreams, longer dreams. People are reporting more hours of sleep. So I think that's part of the effect. But then any crisis tends to stir up dream lives in the direction of having more anxious dreams in general and more dreams about whatever the crisis is. And we're certainly seeing that too.
What are you hearing from frontline medical workers?
The healthcare workers who work in ICUs and emergency rooms were definitely reporting what sound like classic trauma nightmares. Basically, they were very close to what the worst experiences by day were. When I first started the survey in March, I got a few Italian dreams, and those were the first really horrible, a patient is dying in front of me and I'm trying to get a tube down their throat for the ventilator and their airway is too tight and they're dying. Healthcare workers who are working sometimes more than their usual 40 hours a week in ICUs and ERs. It's completely normal to have horrible nightmares if you're having horrible daytime experiences.
What's the science behind dreaming?
Dreaming is just thinking in a very different biochemical state. All of our dreams are not profound. All of them are not silly random ideas. We'd never expect our waking thought to be all one or the other. Sometimes I talk about how people ask if there's a function to dreaming. And again, we wouldn't ask that or at least expect a simple answer for waking thought.
What is lucid dreaming?
Lucid dreaming, the simplest definition is knowing you're dreaming while you're dreaming. And often that results in control, but it's still lucid even if you're just watching it without that. Ever since the movie Inception, it seems like the general public is fascinated by it.
Dreams feel real while we're in them. It's only when we wake up that we realize something was actually strange.
Talk a little bit about dream incubation.
Dream incubation is intending to try to have a particular dream or dream content. It's just the technique of coming up with something you want to dream about. It's helpful to visualize something associated with the topic or question or problem because our dreams are so visual that a visual image gets through even more than the verbal request. And just fall asleep telling yourself you want to dream about that. That's the kind of simple basics of dream incubation, and it's used for a lot of different purposes.
Deirdre Barrett, thank you so much and pleasant dreams.
I'll see you in my dreams.
Mosquitoes are not just annoying, they can be deadly. For years we've used citronella candles, mesh nets, and all kinds of chemical sprays to keep them away. But now scientists think they may have found an effective way to limit mosquito populations. Here's Susan Junn.
They're incredibly annoying pests, but mosquitoes are more than just nuisances. According to the CDC, the mosquito is the deadliest animal in the world, killing more humans annually than any other creature. Mosquitoes spread devastating diseases like malaria, Zika, dengue, and chikungunya, resulting in hundreds of thousands of deaths every year. An unnecessary loss of life which state and federal officials hope to prevent by using genetically modified mosquitoes.
Our non-biting male mosquitoes pass on a self-limiting gene.
Developed by the company Oxitec, mosquito OX5034 is a second-generation genetically modified Aedes aegypti, a species of mosquito that carries several deadly diseases. The male mosquito eggs are genetically modified in a lab and hatched in the wild. Only female mosquitoes bite humans for blood and transmit disease, so when the genetically modified males mate with the females, they pass on a gene that results in the female offspring dying, thus reducing the population of disease-spreading mosquitoes.
This insertion or deletion of genetic components to the genome basically is creating a new total genome.
It may sound like the stuff of sci-fi, but entomologist Dr. Jessica Ware says it's something that humans have been doing for a very long time.
In some ways, genetically modifying things is something that we have done in a less sophisticated way over the course of human history, because we have kind of influenced what genes were selected for using artificial selection, which is how we have modern corn and modern wheat and things like this.
However, a recently approved plan to release as many as 750,000 genetically modified mosquitoes into the Florida Keys does not sit well with everyone. Environmental groups and some residents worry about the potential impact on endangered species of birds and insects that feed on the mosquitoes.
There are many organisms that thrive on mosquitoes. Whether or not the loss of Aedes aegypti as a population, as a series of populations, would be enough to negatively impact these predators is kind of unknown.
Oxitec began releasing its first generation of genetically modified mosquitoes in 2009 in Brazil, followed by the second generation 2 years ago.
In over a decade of releasing more than 1 billion Oxitec mosquitoes, no harmful effects have been reported.
To the contrary, Oxitec claims great success.
In some cases, we've been able to reach a population reduction of the wild disease-carrying population of about 95% in just a matter of weeks.
The plan to release Oxitec's second-generation mosquito came about after Florida Keys officials contacted the company for help in 2012 following local outbreaks of dengue fever. Previous efforts to eradicate the disease-carrying mosquitoes, such as pesticides and even mosquito-eating fish, proved ineffective and costly.
Our regulatory review in the United States was extremely rigorous. We now have approvals from 9 separate regulatory agencies.
Among them, the EPA, which released a statement to us. Since only male mosquitoes will be released into the environment and they do not bite, they will not pose a risk to people. It is also anticipated that there would be no adverse effects to animals such as bats and fish in the environment. Oxitec is required to complete weekly monitoring and sampling of the mosquito population in the treatment areas.
I guess, like most scientists, I would be cautiously optimistic that they have a new method to try and combat something that is such a deadly problem for humans.
Oxitec plans to begin releases of their mosquitoes in the Keys in early 2021. For Simply Science, I'm Susan Junn.
You've seen it in the supermarket, and now it's in the fast food restaurants. Plant-based meat. But what is it? Is it meat? Is it plant? Is it good for you? Does it taste good? Here's our Mike Gilliam with a whopper of a story. By the way, I did not write that.
It used to be the meat portion of your meal looked like this, or maybe this, or a big juicy steak. But for many, that's changing as alternative meats gain in popularity.
The whole industry has exploded as far as bringing out new products, and there are a lot of exciting, interesting things happening.
Craig Rothman is in the Diet and Nutrition Department at Lehman College. I hit him up for answers to some basic questions. So what are alternative meats? What are the ingredients in a meatless burger?
TVP, which is textured vegetable protein, would probably be what you would start with. You'd reconstitute that with some kind of liquid, maybe a stock, and then you'd go from there. You'd add things to bind it together different starches do the trick. So there's a lot of ways to put these together. It's really up to you. If you want to put onions, you'd add whatever ingredients you want. But the base, the protein, the thing that takes the place of ground meat is usually textured vegetable protein.
One of the big companies that is exploding is Impossible Foods. A Silicon Valley-based company now sells its products, including the Impossible Burger, in nearly 10,000 grocery stores in all 50 states. The burger was named the top plant-based burger by the New York Times. It's carried by White Castle and Burger King, to name just a couple of the 19,000 restaurants it's in worldwide. I'm a meat eater, and I haven't really been a fan of plant-based alternatives, but I decided to try an Impossible Whopper from Burger King. I love a good Whopper, so the first time I tried one, it was a straight-up comparison, and I liked the Impossible Burger. So, here we go again. Let's try it. It's fine. Tastes just like a Whopper. But getting that taste took a lot of work in the lab. So why does the Impossible Burger taste so much like beef?
The Impossible Burger Company adds a ingredient to their patties. It's plant heme, and it has iron in it, and it gives that quality of animal meat.
So here's a dual-part question. Are plant-based foods better for you and the environment?
It's got to be a straight comparison. You can't judge it on its own. And I would say there's no question that alternative meats are better for you. They're more healthy for you. I think it's hands down better for the environment.
Proponents say plant-based foods are better for you and for the environment because growing cattle for beef uses much more land and resources, including vast amounts of water. For Impossible Foods founder Pat Brown, it's all about sustainability.
And we're not going to stop until the global food system is truly sustainable.
Impossible Foods is not the only player. Beyond Meats is another growing company with products in many grocery stores. And there are changes coming on the horizon, many of them coming from the laboratory.
The Memphis Meats Company is working on a product where they take a cell of an animal and they put it into a container, and they give it what it needs as far as amino acids and all the other conditions they control. And you can actually grow animal cells to enough where you create a patty or the first meatball, not taken from an animal, but actual meat was created not that long ago.
In the meantime, the hope from the alternative meat crowd is that people will just give the products a try for the sake of their health and the environment. I'm Mike Gilliam for Simply Science.
New Yorkers have one of the most distinctive American English dialects, and a group of cutie linguists got together over a cup of coffee to create an online database to study the New York accent. You got a problem with that? Here's Donna Hanover.
Okay, now, this show used to be hosted by my friend Paul Baldwin, but he developed Spilkus in his Genectigazoink.
How New Yorkers Talk has long been fertile material for actors and comedians like Mike Myers and Madonna in this classic Saturday Night Live sketch. And it is also of interest to researchers who study language. Cecilia Cutler is a professor of linguistics at the City University of New York Graduate Center and Lehman College.
Linda, don't talk to me. I'm having a bad hair day.
We hear three distinct patterns in Madonna's speech. We hear her doing the raised thought, as she said, talk. And then we hear her do the tensed A in bad. And then we hear her do arlessness in hair.
Professor Cutler teamed up with three other CUNY professors and one from the University of Pennsylvania, forming the New York City English Research Group. With funding from the National Science Foundation, they are creating the Corpus of New York City English.
The Corpus of New York City English is a large database of interviews with New Yorkers, and it's ultimately a tool for researchers to analyze language in New York City.
Linguists spend a lot of time studying the way people say vowels, and they have a chart that shows English has 15 vowel sounds.
Instead of saying ooh, the ooh or the u sound, you would say that's the goose vowel. Goose. If it's the O sound, it would be the goat vowel.
And then there are the ways people change those vowels in their dialects.
A lot of New Yorkers raise the vowel in coffee and in thought, so it sounds something more like coffee and thought.
What do you mean when you say raised?
When we say a vowel is raised, we mean that the tongue is higher in the mouth. So compared with the sort of normative mainstream pronunciation, someone who has a raised thought vowel wouldn't say thought. They'd say something like thought. Another typical pattern that you'll hear is the tendency to drop the R when it follows a vowel. So in a word like park or car, you'll hear some New Yorkers say something like park and caw, and that we call R-lessness.
No doubt the corpus will also be helpful to actors, though some, like Joe Pesci and Marissa Tomei in My Cousin Vinny, are already ahead of the game.
Can you answer the question?
No, it is a trick question.
Why is it a trick question?
Watch this. Because Chevy didn't make a 327 in 55. The 327 didn't come out till 62. And it wasn't offered in the Bel Air with a 4-barrel carb till 64. However, in 1964, the correct ignition timing would be 4 degrees before top dead center.
She has the raised thought vowel, and she has a tendency to stop her, what we call stopping of the interdental fricative. So that's the TH sound in 30, so it tends to sound more like a T. So those kinds of expressions are maybe not as widespread as we think they are, but they're certainly iconically associated with New York City.
Our language reflects the many immigrant groups who settled here. And we New Yorkers even make street signs to brag about some of our favorite words. Professor Cutler says New Yorkers do have a highly engaged conversational style.
It's very, very interesting to watch New Yorkers. They love to butt in. They love to jump into conversations. They're comfortable talking to strangers. They'll grab your arm and stop in the middle of the street to have a conversation or tell you a particular kind of stories. They're comfortable with overlap and interruption.
By the way, if you want to jump in about how you pronounce words and how New Yorkers talk, they'd love you to take their survey online.
The corpus is meant to be a tool for other linguists so they can compare other large cities like London or Toronto, where other corpora are being built currently, to what's going on in English.
I'm Donna Hanover for Simply Science.
He roamed the Earth 66 million years ago, and now everyone's favorite dinosaur has gotten a complete makeover. Here's Andrew Falzone.
When you think of a tyrannosaur, this is what you think of. A T-Rex, a mighty predator, 13 feet tall, weighing between 6 and 9 tons. But the new exhibit, T-Rex Ultimate Predator, at the American Museum of Natural History, brings to life some of the newest research on the T-Rex and introduces us to other members of the Tyrannosaur family.
We're trying to just tell that evolutionary story of how like a pretty much run-of-the-mill traditional dinosaur could evolve into like this mega predator.
Dr. Mark Norell is the curator of the museum's paleontology division and has helped excavate some of the specimens that are included in the exhibit, like this small species called Dilong. But the first T-Rex you meet in the exhibit is what scientists now believe a baby looked like, more feathery turkey than ferocious predator.
The teeth are tiny and they're really pointy, and it probably had a very different diet than an adult T-Rex had, because it certainly couldn't crush bones, so it probably ate things like, small lizards, small mammals, frogs, that kind of thing.
But T-Rex didn't stay that small for long, as researchers now believed it gained an incredible 1,700 pounds per year until it reached its adult size. The average T-Rex had an eyeball the size of an orange and teeth the size of bananas.
And in some of the cabinets right back here, we have teeth that have been taken out of the jaw, and you can see like the tooth might be this long, but only like this much of it is actually exposed in the mouth.
Other members of the Tyrannosaur family are sharing the spotlight with T-Rex. Some are on display as life-size model like this Proceratosaurus, others as life-size images. The exhibit also features a number of hands-on activities. You can touch a T-Rex leg bone, enjoy a virtual reality experience, and even come face-to-face with an animated monster. The museum and T-Rex have always had a special relationship. It was back in 1902 when the museum's renowned fossil hunter, Barnum Brown, discovered the first T-Rex remains in Montana. Since then, the reptilian carnivore has captured the hearts and horrors of people worldwide, playing a starring role in feature films like the Jurassic Park series. But a T-Rex feature you won't see even in the newest Jurassic World films is a T-Rex sporting a new hairdo, or in this case, a featherdo.
We speculate that if Tyrannosaurus Rex as an adult had feathers, which we believe it did, it was purely for display. Probably on the head, probably on the tail.
I'm Andrew Falzone for Simply Science on CUNY TV.
By the way, before you visit the T-Rex exhibit, check their website, the American Museum of Natural History, amnh.org. They are open, but with timed visits and other safety restrictions. And you can always find us on the web at tv.cuny.edu and Facebook and YouTube. I'm Barry Mitchell. Thanks. Trick-or-treaters. There you go. Socially distanced Halloween.
Thank you.
There you go, kids. Please take care of yourself. We need the viewers. I'm Barry Mitchell. See you next time on Simply Science.